And look, just on this coronavirus fiasco, and I won't go on any more about it, it's driving us all nuts, but there's something else that you're not being told. I've raised this many times before, but there is solid evidence that hydroxychloroquine works. Governments talk about listening to the experts. Well, this is like climate change. Government will only report the science that agrees with what their bureaucrats tell them. Last week, the International Journal of Infectious Diseases reported that hydroxychloroquine cuts the death rate of coronavirus in half when it's administered to hospitalised patients. Why aren't we told this? A fairly significant sample study, 2,541 patients, has been conducted by the Henry Ford Health System in Detroit, Michigan. Only 13% of the hospitalised patients who were given hydroxychloroquine died. 26% who were not given it did die. Hospitalisation is related to those whom we know are vulnerable, those over 70, the elderly and those who have certain preconditions. Clearly, this study indicates that hydroxychloroquine worked, whether or not it was given with the antibiotic, which is recommended, azithromycin. Now, the study found hydroxychloroquine worked better with azithromycin, and the key to the study was early treatment. 91% of the sample group started their medication within 28 hours. Then also last week, Nature Reviews Immunology published results of another experiment, a randomised clinical trial conducted by Mount Sinai Hospital in New York. It found that 0 of the 31 patients in the hydroxychloroquine group progressed from mild to severe. Now, if there are studies, as there are, which show that early treatment with hydroxychloroquine could prevent about 50% of the deaths from COVID-19, and the addition of zinc sulfate could further reduce the death rate by 20%, why are we not being told that? And what are the lecturers in government who call themselves politicians doing about it? Surely we should be looking at why countries in Asia have much lower death rates than those in Europe and America. Evidence suggests that only 3 people per million have died in China. I suppose we can dismiss that. We don't know whether they're telling us the truth or not. But 6 per million die in South Korea, 8 per million in Japan, and 14 per million in India. But 400 per million die in the USA, 537 in Sweden, 651 in the UK, and 843 in Belgium. But according to India's newspaper, the National Herald, and I quote, a Shanghai-based doctor says China is close to winning the battle against COVID-19, and the combination of zinc, hydroxychloroquine, and antibiotic azithromycin have been able to save the lives of coronavirus patients. Where is our health bureaucracy? Why is this not being acted upon by our political so-called leaders here? I hope we're not killing people by ignoring scientific studies. We seem to be good at this alarmist talk, which is frightening the tripe out of Australians. No wonder Australians have had a gutful. Tell me what you think. You can email me, alan@skynews.com.au. But the great Mark Latham joins me. Mark, what on earth do you make of all of this? Lovely to have you on board again. We won't talk cooking. Have you fed yourself?
Yeah. Had a lovely Vietnamese chicken rice noodle dish. And the key, Alan, is the sauce. I mean, this sauce, for the fresh Vietnamese taste, you put in the rice wine vinegar, the sesame oil, a bit of brown sugar, and fish sauce. And it's a winner, 100% winner. You got to get the sauce
You're
right.
Amazing. Before we get on to this, what is all this nonsense about Scott Morrison going to the football? Seriously.
Well, you know, down there representing state seats of Cronulla and Miranda and the federal seat of Cook, it's compulsory to support the Sharks.
Yeah.
You get kicked out of the Shire
Absolutely.
if you're not a Sharkie. And I think people should be happy that the Prime Minister does something to do with his electorate.
Correct.
In his spare time. And if it's a sin to go to the footy, we'll all be out of public office. I love the footy, and I hope Anthony Albanese's there supporting his Rabbits against the Knights in the coming round. I mean, people would whinge about anything.
Absolutely.
And you've got lefties out there thinking, oh, if we go on about the footy, we'll get into Morrison just like they did in the bushfires. Well, it's nothing like that at all, and it's just the sign of their derangement syndrome they've got about
Good on you. But just come back to this pandemic. 50 people in hospital, 17 in intensive care. Is that a pandemic?
Well, no, we haven't had a pandemic in Australia, Alan, and the virus has been in our country for 6 months, and 3 people under the age of 60 has passed away. Correct. It's the only time in Australian history that someone passing away at age 95 will get in the headlines. Yeah. We've had 3 people under the age of 60 who've passed away out of 108 deaths. As you say, we've got 17 in intensive care, 7,000 intensive care beds. Driving in here tonight, was listening to the ABC, where you had a host and a so-called public health
Talk about the derangement syndrome.
Well, they're trying to convince each other that the hospital system is about to be overrun.
Yes.
17 in intensive care, 7,000 beds, it's 0.2% of the total.
Right.
Yet what Paul Murray has so aptly described as panic porn in the media, they're trying to build up the hysteria way out of proportion. We haven't had a pandemic here.
No.
And
in
politicians
America,
who react to this stuff...
in America, 0.004% of the population have died.